Parkinson's disease is often imagined as a condition that causes shaking hands. But that picture is incomplete. Parkinson's is a progressive neurodegenerative disease, meaning it involves the gradual damage and loss of specific nerve cells over time. It mainly affects the central nervous system, especially brain circuits that help control movement, but it is not only a movement disorder. It can also affect sleep, mood, thinking, smell, digestion, blood pressure control, and other automatic body functions. The reason Parkinson's can look so different from one person to another is that it touches several systems at once. Some people first notice a tremor. Others may notice stiffness, smaller handwriting, slower walking, constipation, loss of smell, depression, or sleep problems long before a diagnosis is made. The classic movement symptoms of Parkinson's are grouped under the term Parkinsonism. These include tremor, bradykinesia, rigidity, and postural instability. Tremor is the symptom many people recognize, often appearing when a hand is resting rather than actively moving. Bradykinesia means slowness of movement, but it is more than simply moving slowly. It can make starting a movement difficult, reduce facial expression, soften the voice, shorten steps, and make everyday tasks like buttoning a shirt take much longer. Rigidity refers to increased muscle stiffness, which can cause discomfort and reduce the smoothness of movement. Postural instability, or difficulty maintaining balance, often becomes more noticeable later and can increase the risk of falls. Parkinson's also has a major non-motor side that may be just as important to quality of life. Dysautonomia describes problems in the autonomic nervous system, the system that automatically regulates functions like blood pressure, sweating, digestion, and bladder control. This can lead to constipation, dizziness when standing, urinary issues, or temperature regulation problems. Sleep abnormalities are also common, including restless sleep, vivid dreams, or acting out dreams. A reduced ability to smell, called anosmia, can appear years before movement symptoms. Behavioral and neuropsychiatric symptoms may include anxiety, depression, cognitive impairment, hallucinations, or psychosis. These symptoms can appear at any stage, but many become more common as the disease progresses. At the center of Parkinson's disease is a problem with dopamine-producing neurons. Dopamine is a chemical messenger used by the brain to coordinate movement, motivation, reward, and several other functions. In Parkinson's, many of the affected dopamine-producing neurons are found in a region called the substantia nigra, located deep in the brain. This region helps regulate circuits that allow movements to be started, adjusted, and carried out smoothly. As dopamine levels fall, those circuits become less efficient. The result is not paralysis, but a loss of automatic smooth control. Movements become slower, smaller, stiffer, and harder to initiate. This dopamine loss explains why dopamine-based treatments can improve motor symptoms, especially early in the disease. Parkinson's does not usually have one single cause. Instead, it appears to develop through a combination of genetic vulnerability, environmental exposures, aging-related changes, and cellular stress. Some people carry genetic variants that raise their risk, especially in early-onset cases, but most people with Parkinson's do not have a simple inherited form. Environmental factors may also influence risk, though the full picture is complex. What these influences have in common is that they can affect critical cellular processes, how cells produce energy, handle waste, fold proteins, respond to stress, and control inflammation. Parkinson's is therefore not just a dopamine shortage. It is a disease process involving cell maintenance failure, protein handling problems, and long-term neuronal vulnerability. One of the biological hallmarks of Parkinson's disease is the buildup of misfolded proteins, especially a protein called alpha-synuclein. Normally, proteins must fold into precise shapes to work properly. When proteins misfold, cells have systems designed to break them down and clear them away. In Parkinson's, alpha-synuclein can accumulate and form clumps known as Lewy bodies. These clumps are found inside affected nerve cells and are strongly associated with the disease. Lewy bodies are not just debris, they represent a breakdown in the cell's ability to manage its internal environment. Their presence suggests that neurons are under stress and may be losing the ability to maintain normal function over time. The brain also has immune-like support cells called microglia. Their job is to protect the brain, respond to injury, and help clear harmful material. When protein clumps and cell stress appear, microglia can release pro-inflammatory molecules as part of a protective response. In the short term, this response may help contain damage. But if it becomes chronic, inflammation can contribute to further neuronal injury. This is one reason Parkinson's is increasingly understood as more than simple wear and tear. A cycle can form. Protein accumulation stresses neurons. Stressed neurons trigger inflammatory responses. Inflammation disrupts cellular metabolism, and vulnerable neurons become even less able to survive. Over years, this slow process can translate into gradually worsening symptoms. Diagnosis of Parkinson's disease is mainly clinical, meaning it is based on a person's symptoms and a neurological examination rather than a single definitive blood test. A clinician looks for patterns such as bradykinesia combined with tremor or rigidity, how symptoms began, whether they are worse on one side, and how the person walks, turns, gestures, and maintains balance. Medical imaging can support the diagnosis in some cases. PET scanning and related techniques may help assess dopamine system activity, but imaging is usually part of a broader evaluation, not a standalone answer. Doctors also consider other conditions that can mimic Parkinson's, including medication effects, vascular problems, or other neurodegenerative disorders with Parkinsonian features. Parkinson's disease typically appears in people over the age of 60. Around 1% of people in that older age group are affected, making it one of the more common neurodegenerative diseases. When symptoms begin before age 50, it is often called early-onset Parkinson's disease. Early-onset cases can differ in their course, genetics, and treatment challenges. For example, younger patients may live with the disease for a longer period and may experience medication-related complications over time. Still, age alone does not define the experience. Two people with Parkinson's can have very different combinations of tremor, stiffness, slowness, sleep problems, cognitive symptoms, and response to medication. The disease is progressive, but its pace and pattern vary widely. There is currently no known cure for Parkinson's disease, so treatment focuses on reducing symptoms and preserving function. The most effective medication for motor symptoms is often levodopa, which the brain can convert into dopamine. Other options include MAOB inhibitors, which help dopamine remain active longer, and dopamine agonists, which stimulate dopamine receptors. These treatments can make a major difference, especially in earlier stages. However, they do not stop the underlying neurodegenerative process. As Parkinson's progresses, medications may become less consistent. People can experience wearing-off periods, when symptoms return before the next dose, or involuntary movements called dyskinesias. Treatment therefore often requires careful adjustment over time rather than a one-time prescription. Non-drug strategies can also play an important role. Rehabilitation therapies, including physical therapy, occupational therapy, and speech therapy, can help people maintain mobility, balance, independence, and communication. Exercise is often encouraged because it can support flexibility, strength, gait, posture, and general health. Diet may help manage certain symptoms, such as constipation, and timing of meals may matter for some people taking levodopa because protein can affect how the drug is absorbed. These approaches do not cure Parkinson's, but they can improve daily function. A good care plan often combines medication with movement training, fall prevention, sleep support, mental health care, and practical adjustments at home and work. For some people with severe motor symptoms that no longer respond well to medication, deep brain stimulation may be considered. This treatment involves surgically implanting electrodes into specific brain regions involved in movement control. The electrodes deliver controlled electrical pulses that can help regulate abnormal circuit activity. Deep brain stimulation is not a cure, and it is not appropriate for everyone, but it can reduce tremor, stiffness, slowness, and medication fluctuations in carefully selected patients. Non-motor symptoms remain harder to treat. Problems such as mood instability, sleep disturbances, cognitive changes, and autonomic dysfunction often require individualized management, and evidence for many treatments is still limited compared with motor symptom therapies. Living with Parkinson's disease means living with a condition that changes over time. Life expectancy is often near normal, although early-onset Parkinson's can be associated with reduced life expectancy across a longer disease course. The larger challenge for many people is not simply survival, but maintaining independence, safety, identity, and quality of life. Parkinson's affects the person diagnosed, but also families, caregivers, and daily routines. Understanding the disease helps reduce fear and confusion. The tremor, slowness, stiffness, sleep changes, mood symptoms, and cognitive issues are connected to real changes in brain systems. While there is no cure today, symptom treatments, rehabilitation, supportive care, and ongoing research continue to improve how Parkinson's is managed. If you found this helpful, please like this video and subscribe for more explainers.